Periods in space, the astronauts' silent challenge. Sunita Williams floated effortlessly inside the International Space Station. Her movements smooth, her mind focused on the daily experiments and technical tasks that kept the mission running. She had spent months in space adjusting to life without gravity, where simple things like eating, sleeping, and even using the restroom required careful planning. But there was one question people on Earth always seemed to ask when she returned. It wasn't about the vastness of space, the challenges of weightlessness, or the thrill of seeing Earth from above. No, it was far more personal. How do women handle their periods in space? A question that once kept women grounded. In the early days of space exploration, this question wasn't just a curiosity, it was a serious concern. Scientists weren't sure if menstruation would work normally in microgravity. Would menstrual blood flow backward? Would it cause health complications? These doubts, among others, were part of the reason women were initially excluded from space missions. Then came Sally Ride. In 1983, she became the first American woman to travel to space, breaking barriers and proving that women belonged among the stars. Before her flight, NASA engineers, unsure about menstrual needs, famously asked if 100 tampons would be enough for her 6-day mission. She gently corrected them. When she returned, the press had their questions ready. Among them was the inevitable. How did you manage your periods? The answer was simple. She packed tampons, just as she would on Earth. Menstruation in space was not an issue. It functioned exactly as it did back home. The science of periods in space. Dr. Varsha Jain, a leading expert in obstetrics and gynecology, later confirmed what female astronauts already knew. Menstruation in space occurs just as it does on Earth. The absence of gravity doesn't change the body's natural processes. Blood doesn't float upwards or cause medical complications. Dr. Rita Bakshi, another senior gynecologist, echoed this. Some people assume that in zero gravity, menstrual blood would flow upward instead of downward, but studies and astronaut experiences confirm that the body functions the same way in space as it does on Earth. How do female astronauts handle their periods? Though periods in space are medically normal, they can be inconvenient. Space stations have limited water, hygiene supplies, and waste disposal options. Managing menstruation in such a setting is challenging. That's why many female astronauts choose to suppress their periods while in space. They use birth control pills continuously or rely on long-term solutions like intrauterine devices, IUDs. These methods allow them to avoid dealing with menstrual hygiene in a confined, resource-limited environment, breaking myths one mission at a time. For decades, spaceflight was seen as a male domain, with questions about menstruation used as a reason to exclude women. But today, female astronauts work alongside their male counterparts, proving that their bodies, just like their skills, intelligence, and courage, are fully capable of handling the demands of space travel. Sunita Williams, like many before and after her, laughed off the question when she returned to Earth. The real challenge of space isn't managing a period. It's the endless push for discovery, survival, and exploration beyond our world. And in that mission, women are right where they belong, among the stars.